Hey guys, welcome back to Medical Coding with Blue. It is Answer Monday. Are you so excited? I'm so excited. Now, I wanted to explain something. I did give you guys more definition questions this time, more than coding, because I think sometimes it's important to go back a little bit. When you are trying to develop critical thinking skills, it is important to understand what this diagnosis means. It's not enough to see it in the documentation, see that it's supported. You really do need to try to understand what is it about this diagnosis, what is it about this collection of diagnoses that would make it more understandable for you. Like, how are you trying to understand it more? What are the symptoms that are involved in this? Okay, this is why a lot of these I asked you, because it's giving you the symptoms in the definition as well. So if your definition of these diagnoses is similar but not quite the same as mine, that's totally fine. Sometimes it depends on where you got the definition from. I did get these definitions from the book itself, from the ICD-10 book. So, all right. So let's go ahead and get into the answers. I will be leaving the answers down in the description box below. These exercises are totally not official. This is just me as a veteran medical coder sharing the things that I know. All right, so let's get into the answers. All right, number 1, define catatonic. The answer is abnormal neuropsychiatric state characterized by stupor, immobility, or purposeless movements, or unresponsiveness in a person who otherwise appears awake. Again, you see how all the symptoms got put into this definition? So, all right, number 2. What are the diagnosis codes for a patient who arrives for treatment of their post-concussion syndrome, insomnia, PTSD, and alcohol use? I got F07.81 post-concussional syndrome, F43.10 post-traumatic stress disorder unspecified, F10.9 alcohol use unspecified. And insomnia is not picked up because it is a symptom of both post-concussion syndrome and PTSD. So even though they may be treating it, it still doesn't matter. You still don't pick it up separately because it's already included in that diagnosis. Okay? So in 2 of them, in this instance, it was put into both of them. So something to keep in mind. All right? The next one is, what are the diagnosis codes for a patient who has frontal lobe syndrome with aggressive personality disorder? The answer is F60.3 borderline personality disorder and F07.0 personality change due to known physiological condition. It's very important that when you are looking up these diagnoses and you see that maybe the verbiage on the official diagnosis code itself does not match, it's very important to recognize and understand that there's a lot of things that mean similar, and there's a lot of words that they're going to be using interchangeably. So always look for those. Make sure that you understand. This is why I tell you guys, understand what you're reading, because if you have to use another word, you need to make sure that it fits. Okay? So the next one is number 4, define post-concussional syndrome and what are the symptoms? The answer, concussion symptoms that persist for weeks or months following a head injury. These symptoms may include headache, dizziness or giddiness, fatigue, insomnia, mood fluctuation, and a subjective feeling of impaired intellectual function with extreme reaction to normal stressors. So you see, I did throw in that definition, and if you were looking, then you'd be able to see that both those, like insomnia, was part of PTSD and the post-concussion syndrome. All right, next one. Number 5, the patient has acute alcoholic psychosis with alcohol-induced persisting amnesia disorder with a blood alcohol level of 45. What is the ICD-10 diagnosis codes? The answer, 10.96 alcohol use unspecified with alcohol-induced persisting amnesic, you know what I'm trying to say, disorder, and Y 90.2 alcohol level of 40 to 59 milligrams over 100 milliliters. Alcohol use is selected due to not specifying it in the scenario. That is why it was coded as alcohol use, not abuse or dependence. It was just coded as use because it wasn't specified. Okay. Number 6. What is the ICD-10 diagnosis code for inhalant dependence with inhalant-induced psychotic disorder with delusions? The answer is F18.250. Okay. Number 7. Define schizophrenia. A group of disorders with disturbances in thought, delusions, hallucinations, mood, blunted, flattened, inappropriate affect, sense of self, also bizarre, purposeless behavior, repetitious activity, or inactivity. Okay. Number 8, what is schizotypal disorder? It is a mental disorder characterized by severe social anxiety, thought disorder, paranoid ideation, derealization, transient psychosis, and often unconventional beliefs. Okay. Number 9, what is the diagnosis code for mild manic episode without psychotic symptoms? The answer is F30.11. And finally, the last question, number 10, what is the definition and diagnosis code for premenstrual dysphoric disorder, or PMDD? The diagnosis code is F32.81, premenstrual dysphoric disorder. It is a condition in which a woman has severe depression symptoms, irritability, and tension before menstruation. So there's your answers. How do you think you all did? So the importance of these exercises, and it gets more and more, I think the level gets up and up every single time. It's important to go back to the basics, especially when you are working in such a detailed clinic like a mental health clinic, because there are so many diagnoses that are so interchangeable with these that you really do have to watch what you're doing. I really do recommend that you read coding clinics if you have access to like an encoder. They have that reference section where you can read the coding clinics. I advise you strongly to read every single mental health coding clinic that you can get your hands on. I also recommend, like I always do, to read that section of the ICD-10 book. There is always the chapter where at the beginning of the chapter it does give like examples on how they select their codes and things like that. Always look through that section and read all of the tips and definitions as well. And this really goes for any clinic that you are in. If you are in the orthopedic clinic, or if you're in a gastro clinic or podiatry or any of those, look in that section where the diagnoses are at and pay attention to all the definitions, pay attention to all the coding tips that are in the book itself, okay? Always go to like approved websites, like websites that are very legitimate, okay? You never want to go to some random, these are my thoughts on this clinic, .com, whatever. You want to make sure that you are looking at legitimate resources, like from, when I was in the pulmonary clinic, I went to the American Lung Association, that kind of thing. If you're looking up orthopedic things, look up orthoinfo.org. Okay, those are going to be legitimate websites. Go through your Merck manual, look in those sections. If there's something that is tripping you up, or you just need help further understanding it, look on YouTube and see if there's anything else that you can find, any other videos. Sometimes YouTube has surgery videos up, and then you can watch the actual surgery if you're looking to really expand your mind and really understand what you're doing by looking up the surgeries. So that's it for me. So I'm going to go ahead and close this one up. But if you have any more questions, let me know. I will be stockpiling questions for Q&A Tuesday still. And Motivation Monday is coming up. So it will be on by at least 6 p.m. this evening. That's the goal. It's going to be up by 6. So just hope you'll tune in. I hope that you will tune in for that. But again, if you have any questions, let me know. I will include my email address down in the description box below. So I will see y'all on the next episode. But if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. I will see y'all on the next episode. Bye.